my name is Carly, and today I'm going to show you how to do blood administration, and then I'm going to do a chest tube dressing change. So first thing I'm going to do, I'm not in the patient's room, I'm just going to check over my blood before going in. So I'm going to perform hand hygiene and start on the blood. So the first thing that I'm going to do is actually just check that I have the bag to the tag. So I'm just checking here. I'll be checking the name after, but I have the patient's blood group, so I have AB positive, and then I have positive here, and they are compatible, so AB with AB. I have the donation number, so I have the donation number as C051008 900 445Y, and that's correct. And then I have the component number as E6050VOO, and then I also have the component blood group as the AB positive, which is the bag type, and they match, and the AB is compatible with AB. I am just noting the volume is 358 ml, and I here have that red blood cells, which is what we're giving, and then I also have the cross match that expires, so we know that that's okay. I'm going to have a second nurse with me throughout the entire process, but a second nurse would either check this bag independently now, or they could have been present with me and we would have done the check bag to tag together. So next thing I'm going to do is check the record of the transfusion and to the blood bag itself. The second nurse would be with me. For the patient name, I would be stating every single letter, but for the purpose of the demo, I'm just not going to do that. So my second nurse is with me. I have Atrique, and then I have the patient blood group, which is AB positive, and I have AB positive here. I have patient fin, so this is my second identifier for my patient. So I have 261824375, so I have my two patient identifiers there. And then I'm also checking my donation number, so I have C051008 900 445Y, and that's correct. And I have component number E605OVOO. Okay, and then I also have the component blood group as AB positive, and that's AB positive, and both are compatible, so that's good. I also have the cross match that expires in 3 days, so that it is not expired. Now that I have checked the record of transfusion to this, I'm just going to kind of show you what I went through in the binder. So I previously already checked this in my prep time, but I'm going to go to the patient demographic just for two patient identifiers. And I have, again, spelling this out with my second nurse present, I would do letter by letter, but I have Jerry Atrique, and then my FIN number I have here, is 261824375, and I have that correct here as well. And I would go through and I just have that there is a type and screen done, so the blood type is there, and that it isn't expired, and that is the right patient as well. We have it with the two patient identifiers. And then I'm just checking also my physician's orders, so that would be my two patient identifiers as well. So I have Jerry Atrique, 261824375, and that's good. And then that just tells me I'm giving packed red blood cells, as we've identified, 1 unit over 2 to 3 hours, and that there is a doctor's signature on there. And I'm also just checking here for the consent, and I see that the patient has consented and has discussed the adverse reactions, and that all their questions have been answered. So that's what I would have checked. Next thing, I'm just taking a look at the integrity of the bag. So I'm looking, no, there's no clots, the bag is intact, and there is the right color, which is red. Next thing that I'm going to do is kind of enter my patient's room here. My second nurse, again, would be present with me at the time. So she's coming into the room with me. I'm just going to perform hand hygiene, and I'm also going to put on gloves because this is administration of blood, and so you should be wearing gloves with it. So while I'm putting on my gloves here, hi, my name is Carly. I'm going to be your student nurse today. I am just kind of doing an entrance safety check at this point too, just making sure that the patient is in any distress and there's no hazards on the floor. And I'm no hazards on the floor. My patient is in semi-Fowler's position already with the bed at my waist height, because I'm going to be doing a dressing change after. So what I'm going to be doing for you today is just administering your blood product because you do have, he went in an accident and lost a lot of blood, so we're just replacing some of the blood today. And then I'm going to be doing your chest tube dressing change. At this point, he has the time to refuse, but the patient is not refusing. And so with my second nurse, I would be going and doing my patient identifiers. So I'd be spelling out every letter for the purpose of the demo. I'm not going to. So I have Atrique on my tag here, and then I have FIN number 261824375, and that is correct. And then I also have my patient, which has no known drug allergies. So the patient at this point, can you just state your first and last name, spelling that out for me, and also your date of birth? Okay, and they have done so as well. And you have no known drug allergies? Okay, good. So the second nurse would have done that with me, and now I would proceed to hang my bag, which it's already hung up there. Okay. So at this point in time, I'm just checking my tubing and making sure that my tubing is the right one for blood, which it is. It does have the filter as well, and it is no ports. So I also have my normal saline here, and I would have an extra one just in case there are any adverse reactions. So I'm just ensuring that the blood is above, in real life, the level of the filter so that there's no damage to the red blood cells. And my line is also all primed and ready to go, so that is good. At this point in time, I would just start programming my pump. So I'm going into the primary. I'm going into my primary. I'm going to change mode, and I'm going to label my line. So I'm going to label my line, and then I'm going to look for red blood cells. Okay, so I have my red blood cells, and then I'm just going to program my rate at this point. I have 358 ml, so going to 358 ml. And then my rate for the first 15 minutes, it's standard protocol to put it over 50 ml per hour. Okay, and I would confirm my primary. So I'm just going to tell you, so I would be with my patient for the first 15 minutes with this running, and then after the first 15 minutes, I would come back, change my rate, and as I previously calculated, I would change it to 197. I would also put in the remaining volume of my bag, which would be 345.5, so you can round up to 346. And then I would be pressing start for the remaining 1 hour and 45 minutes. My second nurse would also check that a second time. So now that I have my thing here, I'm just going to grab my flush. Okay, and I'm going to just be connecting my line. So I'm grabbing the red lumen of a central line. Swabbing for 30 seconds, letting it dry for 15. I have already previously gotten the bubbles out of this. Okay, opening my clamp. Okay, so I'm pushing in 1, aspirating for blood return, and I see that, and then I'm going to push, pause here. Okay, leaving a little bit just in case there are any bubbles. And the patient said it was okay to do this. I'm putting it in the garbage right after. Okay. There we go. Now I'm just following my line all the way up, making sure all my clamps are open. So we're opening the clamps here, and I'm opening this blood one here too. Okay, and all my clamps are open. Everything is ready to go. So I'm just going to press start on my pump. It is running, and I'm also just looking for the 3 drips here.
Starting right next to the tube and around the foot swipe and now moving out with successive swipes, filling in the entire area.
Okay, and now that 3rd drip is running there. At this point in time, I would just be monitoring my patient for any adverse reactions. I would be doing the vital signs as per protocol. Just so that I would have mentioned before starting that pump, I would have done my baseline vital signs on my patient just to have that baseline. Afterwards, I'm going to be checking the vital signs as per protocol over the full time. So that's the first 15 minutes differs every 5 minutes, and then for the remaining that 45 for that hour, I'm going to do it every 15, and then I'm doing it every 30 for the 30 minutes for an hour, and then every hour for the remaining time that it's running. And again, changing that rate after the 15 minutes is up and doing that. So I would be monitoring just for any adverse reactions during that time and throughout the blood transfusion. Okay, so now I'm just going to go into my chest tube dressing change. Okay, so I'm performing hand hygiene. I'm going to just put that aside for now and kind of grab my next one. Okay. And I'm just going to move this over here. Okay. And I'm also just going to put her glove off the patient's bed. Okay. And then I'm checking that the suction is within the low range, which it was supposed to be before. I'm making sure that all of my things are down and that my chest, the suction is on. And so it's on and ready to go. I'm checking that all the tubing is connected properly and going to the chest tube over here. Okay, I'm just going to be going onto your chest tube dressing change now. I'm just doing my safety checks as well. And they have previously checked the doctor's orders and there is an order for this. He's consenting still at this point in time. So I'm coming down to my collection chamber over here. I do see that it is within the 20 centimeters of water which was ordered. I'm just checking that the ball is within the window. It is actually connected. It's below the level of the patient, so proper drainage is ensuring. Checking my air leak meter. It should be filled up with water to that level of the line, and it is, and I'm ensuring that there's no kind of aggressive bubbling in there because that can be a sign of an air leak. I'm checking that there's tidling going in here, and that's with the patient's breaths. And then I'm also just checking for any drainage as well in the ports, and I would be looking at the amount and the color of it, and then I'd be marking where it is at the start of my shift, just at the beginning. Then I'm following up the tubing, making sure there's no kinks or anything going on. And at this point, I'm also just going to demonstrate how to check for air leaks. Okay, so what you would do here, and for the purpose of the demo, I'm just going to press off on my pump. I would be letting it run, but just to ensure there's no noise. Okay, so I'm just going to drape my patient open here. And so for an air leak, you're going to be, oops. I'm just going to position my patient already, and do you consent to this? Yes. Okay, everything is okay. So just putting the arm up here and kind of draping, opening the area. Okay, so I'm just going to check for any air leaks. I would be clamping, noting that this is stitched in closest to the patient, and if I clamp here and it stops, I know that the air leak was above. If not, I'm going to clamp and continuously clamp down the tubing until it stops, and then I would fix it accordingly. Okay, so now I'm up at the patient. I'm making sure the dressing is drying and intact. I'm feeling around for any subcut emphysema, and there is nothing. I'm making sure that the tube isn't dislodged, and everything is good with my patient. I'm also just doing my basket. I'm looking for my items, so I should have my clamps. I should also have normal saline or sterile water, and then also just tape or some kind of gauze 4x4s just in case the tubing comes dislodged. So at this point, I am ready to kind of set up for my dressing change here.
That is the chest tube dressing change. We'll be placing that into a comfortable position. Make sure he's got his call bell, and we'll lower the bed back to a safe level. And I believe that's it. Thank you very much. That's okay. No worries. Yeah.
Here we are, making sure that everything is sterile. So this doesn't need to be sterile. I'm just going to place it under my patient so that any drainage that does occur can just run onto this if there is any when I'm cleaning it. Okay, so I put that down. I'm also just going to take my garbage out, and he said, is it okay if I just put this garbage right over here? Yes, it's okay with my patient, so that's good. Keeping myself open. Okay. And that has still stayed within my border here, so this is okay. But I have kept it sterile, so it hasn't gone outside that 1 inch. So that was okay. and keeping everything sterile within that border. That's good. And now I am just going to insert my sponges here. Okay. Keeping that wire in there. And also my jelonet. I'm just going to grab these ones because they're a little bit easier to grab with.
Yes, please.
Okay, and then I'm just going to add my normal saline in here too. Okay, and now I'm going to just again perform hand hygiene. Okay, and put on my gloves here because I'm going to be taking off the dressing. So okay. Oops. Okay, so I'm just removing the dressing. And again, sometimes Jake can be a little bit stickier than normal.
Okay. Sure, we can do that.
Okay, and the tube is stitched in, but I would just be kind of supporting it just in case to make sure it's more stable, keeping my body open to my sterile field the whole time. Okay, and here I'm just kind of noting if there's any drainage, but there isn't, it's dry. And then I'm also going to be, so yeah, that's okay. I'm just going to be taking that after. And then I'm just going to remove my jelonet here.
Hi there, my name is Matt Clausen. Demonstrating
Okay, make sure that's sterile. And then now I'm just going to remove my gloves again. I'm going to perform my hand hygiene.
for the insulin administration. It was already hung by the previous nurse, so we checked in.
And what I have done here is I did not throw those out.
There's also this
And they should have been thrown out right after. So I know that my 1-inch border has changed. And I'm going to ask another nurse to bring me another forceps. So another nurse is going to bring me forceps in the room. And I'm just going to ensure that I'm using those. And now I know that my 1-inch border has changed here to the edge. I'm actually forceps. Okay, so I just threw out both of them because they were new, and now my 1-inch border is a little bit in here. So again, I'm just ensuring that here, that this, and since I'm keeping the tip still here, I can just take it with my fingers, making sure that this is sterile. I'm going to move my 1-inch border here because they were touching, so my 1-inch border is now a little bit farther in. Okay, so the first thing that I'm going to do, I will be assessing the site, but that's after I clean it.
Administering insulin to you, as well as doing your chest tube dressing change. If you have any questions, I'm going to check his knee band, make sure to have the correct
Just
patient.
wetting.
That's Bryson Scotland.
Okay, and doing the first above the tube and around there. Okay, and that's clean. If it wasn't clean, I would be doing another swipe, but I don't need to because it is clean.
Scotland.
Keeping my tips down.
Units. The volume is total 1 ml of the insulin, but it's 101 ml.
Okay, and then underneath the tubing
Concentration of 0.99 units.
there, and then keeping my forceps sterile. I did not touch that tubing there. 1 semicircle. And then I'm also just going to clean the top of the tubing as well. The bottom is stitched in, so I do not need to clean that. Okay, and then just the top of the tube here. All right. And now I'm just going to be drawing.
And I want to do 2 units per hour, and I had said that was going to be 2 mils per hour because of the concentration.
Okay, and so just 1 swipe above.
2.02 mils, but volume will be 2 mils per hour. So that's correct. I would have my second nurse come in and double check the patient.
Okay, one slide below, ensuring that it's still sterile, and it was, and it's dry.
My third check, that's all been completed. Making sure that all my lines, my TKO is running.
Okay, and then the top of the tubing here, and that's dry.
Is open as well.
Now I'm just going to assess the site. I don't see any signs and symptoms of infection at all, so that is good. And now I'm just going to actually put the jelonet on. There's no kind of redness or swelling, anything like that, so that's good.
Time, so it's clean, it's all been primed. Make sure that there is fluid right to the end. And clean this up. Again, if I was concerned
Yeah,
about
not touching any of this
contamination, I would be wearing gloves for this whole procedure as well. But just for
Getting the jelonet kind of ready and easier to go.
just demonstrating this, but I have gloves on about to
Okay, I'm gonna kind of roll it here myself.
the line for the connection. So I have that hooked up. My second buddy nurse has done.
Right. Now I'm just gonna put it around the tubing, ensuring to keep my things sterile, but it has been cleaned already.
I can confirm the primary.
So you can touch the skin that was cleaned in the area, but just ensuring that my forceps are okay.
Just 2 mLs.
Okay, and that's to prevent any just air or excess leaking. So now that this is on, I'm just going to be making sure to
2 drips.
put on my drain sponges. Okay, so that is dropped, and I'm going to ask another nurse to bring me an extra drain sponge. Okay, and so another nurse has, and I'm again keeping that 1-inch border in a little bit because I've broken that before. Okay, and then with this drain sponge, making sure to keep it all sterile. There. Okay. And I'm keeping that slit kind of sterile here. I'm just gonna kind of move the tubing out here a little bit. Again, that is stitched in, so that's okay. There. It wouldn't have done that in the real patient. I just was moving the tubing a little bit. Okay, now that that's on, I'm just gonna do my 4x4 here.
I'd be watching for those.
Making sure that's on.
Make sure that 3 drops to make sure it's running.
Okay, and now the sterile portion is over. So I am just going to put my Mefix on.
Know that it's working. And
One side off at a time.
TKO is running as well. That's the insulin infusion portion of it.
Right.
I'd be monitoring his blood glucose. It was done before. I'd be monitoring Q1H after. He has the right 3 Qs. The right evaluation.
Okay, and again, I would be date timing and initialing the dressing here.
My safety checks for the chest tube. I'm making sure that I have water in the room.
So that would be date time initial on the bottom, and I'm making to ensure that this is all covered and that I would tent my tubing here as this comes off. So tenting my tubing. Then I would be cleaning up my site. I'm going to just remove kind of the garbage here, clean it up, make sure that my patient is again in a comfortable position with the bed lowered. I would be documenting with my nurse the findings that I found on that dressing as well as the site. And then just to note, the blood the nurse would have signed on my documentation, the bag, or the transfusion record in the bag, because it is a 2-nurse thing. I'm performing my hand hygiene, doing kind of my exit safety check, making sure the call bell is within reach, and then exiting the room.